Every once in a while, a baby is born months premature and weighing less than a pound, or there's a horrific accident or maybe a stroke. These babies can face debilitating neurological conditions or degenerative neuromuscular disorders. They might be unable to speak or move. The point is that each individual child's problems are astoundingly complex and very different from the child across the hall. This is a story about a remarkable place where these challenges are confronted head-on. We take you now to Blythedale Children's Hospital in New York, which has been addressing the most pressing medical needs of infants and children for the last 130 years. But here is the amazing thing. It is the singular concept around which every child's care revolves. Let kids be kids. Every patient is a child who wants to laugh and play and be part of this world. And through advocacy on their behalf and an unrelenting commitment to finding new ways to improve their access to care, Blythedale is helping them to do just that, all while teaching parents how to become confident caregivers so that these medically fragile children eventually can go home. And despite the many challenges, that is a milestone they achieve for more than 90% of their kids.
We get families when they are at probably the most stressful time in their life. They have a lot of fear, they have a lot of worry. They know they need help, they know their child has potential, and they just don't know what to do next. So we can help them understand their child's current abilities, help them build on those abilities.
You walk through these walls and you're not a child with a disability. You're really looked at as a child with possibilities. And within these walls, those possibilities become realities. So if you had to ask me what was the one thing that's different about here, what do you feel when you're within these walls? I think it's hope.
The first time I walked through the doors of Blythedale, before I even got into the entrance, I was mesmerized by the elephants that are in the parking lot. And immediately I felt that sense of relief. And when I walked through the doors and I saw smiling faces and I saw the fish tank and I saw everything come together, and I knew that this was going to be our home away from home.
Yeah. That would help, right? Probably.
So the mission of Blythedale is to improve the health and quality of life of children who are medically fragile. And that's meaning taking care of kids that have complex medical illnesses and very debilitating medical and physical conditions.
That's the easy part.
That's the easy part, now that you can do that on your own, right?
Yeah.
Yeah.
And we do that in a multidisciplinary approach where we've got physicians here 24/7, 365. We have physical, occupational, and speech therapists, around 90 of them, which is the largest cadre of therapists that just focus on children in the entire state of New York. And then a whole great clinical team of nurses and respiratory therapists and pharmacists and social workers, all aimed at getting the medically fragile child well and back home. And we're able to get 91% of these children home. And that's a statistic that I'm most proud of here at Blythedale.
Let's set ourselves up. And Kira's going to be right with us. Come on in.
Our role in the healthcare spectrum is really to help children transition from acute medical care towards home.
Your turn. Whose turn is it going to be?
Who are you picking?
In addition, we also are a source for those children to receive other types of care. And what's extremely unique about here is we have our own school district.
Like I
like to play
with
crayons.
my crayons, right? And do some coloring.
It allows us really to look at the whole child. How do we optimize their function? How do we help them succeed out in the world while also allowing them to be with their peers and do what other kids do?
October 31st, 1997.
So we have outpatient therapy services that we do here. And then there are some children who, by nature of their needs, can't go home. And so we have a long-term care facility.
Most of our children, over 70%, are on Medicaid. So Medicaid, unlike in private insurance, is not the best payer.
Most children are healthy, and so the types of care that Blythedale provides is for a very, very narrow segment, but expensive segment of the population. Children who have experienced a traumatic brain injury or born prematurely. Many of them live in low-income families, but even middle-income families, the type of needs, the intensity of the needs of those children go far beyond what those families can support and what private insurance will support. And so a very large share of Blythedale's revenue comes from the Medicaid program.
Is those branches in the breeze?
Most politicians don't understand medically fragile children, and I get it. They're such a small percentage of the population. But my job as the CEO is to essentially be the lobbyist for those children, for those families. My testimony this evening is not about ideology. It's not about my personal political opinions. It's the product of my 43 years of professional experience in healthcare, primarily with children's hospitals.
Larry is an advocate down to his bones. Larry is a believer in good government, and the test of government really and of a civil society is how we treat the children that are here being cared for at Blythedale.
But our frustration is that while the child has met its medical necessity criteria and we're training the parents, the insurance companies deny us for the continued care. And that is crazy. That has to stop. That has to stop.
There is no more vulnerable population in our country than medically fragile children. There are very, very few people who would have the resources and the wherewithal to by themselves provide all the services and supports that medically fragile children need. I've met mothers who have quit their jobs, gone back to nursing school, and literally sleep on a mattress next to their children's beds at night for fear of keeping them alive.
Families who had a normal, healthy child and suddenly their lives are turned upside down. How do we teach them to be not only to care for their child, but how to be a family again? How do we transition them back to their community?
Have one? Let's go get this one. You want to get it?
We have a bit of the luxury of time here. The length of stay here is about 2 months. In the acute care hospital, it's about 5 or 6 days. So we can do a lot more, weaning the child from the ventilator, getting the child to walk and talk.
Let's find in our talker what we need.
Go away, big green monster. Oh my goodness, tell him go. Use your talker. Use your talker, tell him. Good trying.
We can do that in a much more relaxed, progressive, structured way. Parents have the ability to sleep here. You can't do that in your ICU.
This is the newest addition to our family. The eyes open and close, it breathes up and down, it moves its arms and legs.
And we can also insert a trach, which most of our babies have a trach.
So our simulation lab has really dynamic and powerful teaching tools, not only for our staff, but it's a great way for families to start to get introduced to these devices or pieces of equipment on their child that can be very scary, very overwhelming.
You like to change the tubing while the vent is on,
Yes.
right? Compared to the option of changing the tubing while the vent is off because Levi is on trach collar.
Our child life specialist will kind of work through like therapeutic play, getting parents desensitized to the equipment, letting them play with touch, feel on a mannequin or a doll long before they ever have to do it hands-on in their child. So it's a progression.
The parents will be able to train, so they have ventilators, they learn how to suction, they learn about vital signs. Remember, they have the comfort of being here at Blythedale, but when they're home, it's a whole new deal.
When Levi was in the NICU, of course, there was things we were not allowed to do. In the beginning, he was so sensitive that we had to basically just ask for permission if he was stable enough to be able to hold him. And when we arrived here, we had that mentality of, can I, may I? And the nurses here were just like, it's your child, you know? You absolutely, if you don't know how to do something, we'll definitely be more than happy to teach you.
Levi was born at 25 weeks gestation and weighed about 1.5 pounds. He was the second born of twins, and he developed severe respiratory distress because of his lung immaturity. And he was really close to not making it. He came to us after this episode where he could finally be stabilized on a ventilator. He's at risk for neurodevelopmental problems, and that's why all the therapists are working with him.
One of the things that I saw at the acute children's hospital where I was executive director were that these small infants, 6 months, a year, even 2 years old, that required ongoing ventilation. They were on a respirator, and there was really no other place to send them. So we developed this unit here at Blythedale Children's Hospital to continue to wean those children off of a ventilator. And we're successful with that over 70% of the time. I see lots of parents being able to take care of their kids, give their child a bath, which they were never able to do in the acute care children's hospital. But you can imagine how daunting that is when you have a 2 or 3 pound baby tethered to all these tubes and monitors.
Hi, Levi. Say hi. Say hello. Say hello.
Levi is at a stage now where he's over a year old. He is just starting to sit up, and he's up to about 10 hours off the ventilator a day.
What's going on? Are you going into your chair?
He's tolerating what's called trach collar. So that's a collar that goes over the tracheostomy. It's loose. It's not attached to a ventilator. It's just supplying humidity and supplemental oxygen.
Remember, when they're in the neonatal ICU, they're tethered to all of this machinery. Here, we're able to work with the doctors and the nurses to put the children on portable ventilators.
Their boys were born on February 12, 2019, and when their first birthday was around the corner, I remember speaking with the medical team, seeing if there was any possibility of them being able to meet in a common area of the hospital. So a few days before their birthday, he was trialed on what is known as the LTV vent, which is the vent that he's on now at night, and that's a portable vent. And we were hoping and praying that he was going to tolerate it so that we would be able to bring in Benjamin and they would see each other at least for an hour.
And that was, oh, come on, you can breathe, you could do it. And we were all rooting for them because we knew even if it was just for 15 minutes, half an hour, for the twins to be able to see one another for that milestone was just such a huge moment for the family, given all of the hardships that they'd endured to get to that point.
When they came together on their first birthday, they were kind of like analyzing each other, like, you kind of look like me. I think I know you. Wait, you're with mom. She's my mom. You know, so it was just so funny to see. It was definitely, yeah.
When Levi's ready medically to go home, the goal is that the family will feel proficient in his care, confident. They will have had opportunities for trial runs to take him outside if it's a nice day, learn what it means to navigate an adapted stroller and a ventilator and oxygen and all of these complex things. So they're essentially becoming skilled nurses in their own child's medical care.
Let's ride the Jeep, Alaya. Come on in.
At Blythedale Children's Hospital, we work with children who have deficits across all areas of function. Children who are learning how to move in new ways, finding new ways to interact with their world, finding new ways to communicate.
Oh, you're so fast. I'll come this way? Let's go this way.
To the best we can, we restore function or develop function, but when we can't, we find ways to accommodate or find a new way to achieve a skill. So assistive technology is really any device, product, software support that can improve functional capacity for a person with a disability.
Stop. Stop. Go. Pencil.
Maybe she's looking for camera.
School.
Looking at the camera.
And in the last several years, we've pulled it together as a separate department and entity so that we could really focus on those needs for each individual child and each family to restore as much function as we possibly can and get them the equipment they need.
So we're going to play around with, when you're driving, whether or not you want both controls to be able to control the stand, or if you just want the controls to be through the joystick. So you got some work ahead of you. You ready? All right.
So the full scope of assistive technology can be something as small and invisible as a software modification to a child's phone or a computer, or something as large, expensive, and robust as a standing power wheelchair.
So you're going to pull the joystick towards you, and you're going to start to tilt back, and it slowly elevates. And at any point you take your hand off the joystick, you could stop. So you don't have to come fully up into standing, or you could kind of be in a squatted position, whatever you feel like doing. Okay.
So we're very excited that she has had the opportunity to try out a new standing wheelchair.
Do you want to give it a try?
Yeah.
Okay.
And this is something that I happened to just find online, actually, as I was just thinking about, different types of equipment that was out there, and, thinking a lot just from the standpoint that, when she's sitting in a wheelchair, she's not at eye level, with her peers.
I know, look at you. So do you want to try to go a little faster? Or yeah, okay, so you can increase the speed right here.
I contacted the equipment clinic staff, and I thought, have you ever heard of something like this, a standing wheelchair? And I was so impressed that they, immediately responded to me. They were excited to try it out. They were able to get a demo right away through the vendor working with the company. We were also fortunate to be able to have the company bring the demo to our house just to see whether or not if it would fit.
Yeah.
How does it feel?
Good for now.
Good for now. All right.
And she's very excited to be in the standing wheelchair. We're very excited about all the possibilities of the different things that she's going to now be able to do.
I can help my mom cook.
Help my mom cook?
Everybody over your because it's way up
Yeah, very good. She said, hello, everybody. She hopes that other children can also get a standing wheelchair because it can help you do a lot of different things.
Kids are developing. And if kids don't get the assistive technology they need and they miss milestones, it will further hinder their development. That's why we can't ever give up on these kids. If they don't get technologies and they can't go to school because they don't have these technologies, they can fall further and further behind.
You good? Okay. Are you ready to go in your go-go car? Okay, Nora's calling Daddy.
So we have children who have really, really challenging bodies. And they truly are trapped in their bodies and have very little movement.
Are you ready, baby?
So those children, assistive technology is essential. It is the way they open their world.
Yep. Because this is where he was yesterday.
Zaire is a little guy with a progressive neuromuscular disease that has affected his ability to express his wants and needs, so he is using his eyes as a means for interacting with an iPad.
More. Or stop.
Stop. What are we gonna do? You tell us.
He doesn't speak, he doesn't reach, he doesn't walk. There's lots of challenges in his daily life, but he is absolutely interested and motivated in typical 3-year-old things. So with working with the full rehab team, and he is one that needed the whole team. He needs a nurse, he has a ventilator, he needs a respiratory therapist, he needs a doctor, he needs each of the therapists. We can work together, and we're trialing him with things like accessing a power chair using what's called a proximity switch, which means he doesn't have to touch a switch. It can just sense if he's getting closer to it.
Did you say like? I saw that. You said like. You like to go. I know.
And he is also using his eyes to make selections on his computer and play games and initiate communications.
Here, I'm going to fix your hand just a minute, okay?
Zaire lights up when he's able to do something for himself. He's ecstatic when he can control what he's going to do next. I mean, he's 3, right?
Ready? 1, 2, 3, give me squeeze. Good boy. There we go. Good.
I mean, Zaire will also be one that will be challenging because the equipment he's going to need will be expensive, will be difficult to justify, will take a lot of family training and a lot of challenge in the home to accommodate all the pieces of equipment and devices for him. So it'll be a long haul, but I think he'll get there.
Say hi, everybody.
Hi, everybody.
I'm back.
I'm back.
Emily had suffered a traumatic brain injury. It was during a horse riding class with her sister. She was paralyzed completely on the right side. She lost her ability to speak. And we spent the next 4.5 months living here at Blythedale.
I don't think anyone has any idea what it's going to be like in this medical emergency situation. And in the back of my mind, it's like, no big deal, I have insurance. Well, you have lifetime max issues,
yes.
And you have now pre-existing condition coverages, but then not really, and who knows what tomorrow will have.
And for our family, Medicaid saved us from financial ruin.
Hi.
It paid for her services here, for her time here at Blythedale. And there are so many children here at Blythedale that need it. And the thought of it being taken away or not available to these children, it really,
it's criminal.
It's so upsetting to me. And I don't know how we don't stand up and say, no, this is not okay. So we fight for Medicaid. My daughter should not be denied health care because of a pre-existing condition. We were asked to join Larry for a press conference with Senator Schumer here at Blythedale. And it was to fight for Medicaid, that there wouldn't be any cuts, which would directly affect the hospital. And he is so inspiring, the way he fights for these children. It's as if they're all his children. And I think for me, it gave me the courage to speak up. I will not let my daughter be discriminated against. And we have the best gift. We have our voice. We always stayed together. There was always a lot of love.
Elephants.
There was a lot of elephants, which came to kind of signify our journey, an elephant, because an elephant never forgets. They never leave a loved one behind.
I actually got an elephant necklace and I never took it off. like for 2 years straight because I knew elephants were really important.
Yeah.
And they would always be by my side to protect me.
So we became
elephants.
When Emily came to Blythedale, this was a child that had undergone this catastrophic brain injury, and she was unable to dress herself, feed herself, unable to speak, unable to walk. And you know, she's back, Emily is back. As you might imagine, in a setting that deals with incredibly medically fragile children, we have a lot of ups and we have a lot of downs, and those successes just bring so much joy to the entire team.
I've been at Blythedale now for 20 years, and it's been 20 amazing and glorious years of my life. I've seen care given to tens of thousands of children here at Blythedale Children's Hospital. It's an honor and a privilege to be the executive of this great hospital.
Blythedale is filled with young patients fighting against burdens that no child should ever have to face. Their fight is our fight, and we are unrelenting in our commitment to help them get better and improve their quality of life.
Former preemie twin Levi was discharged home a month after we filmed this episode. He was able to celebrate the holidays with his brother Benjamin and the rest of his family. For the Visionaries, I'm Sam Waterston.